play. We'll allow y'all videos to come on now.
Still says unable to start. You cannot start your video because the host has stopped it. All right, so I'll go ahead and jump in since to try and make sure we frame this conversation appropriately. You know, last year we had to do everything virtual, everything from application review to the interviews to the second looks, all the way to the match process. It's not uncommon that these processes, some of the process is virtual and doesn't involve in-person communication. But I think one of the lessons learned is that we can do interviews and be successful in identifying candidates for our residency programs through our virtual interview process. And I think more importantly, applicants who are to become trainees can learn a lot about residency programs through the virtual space. I think it's important for you all as applicants to really do your homework before you even apply so that you can have an understanding of which programs you're applying to, get a better understanding about what they offer, what happens to their trainees when they go on beyond residency, because that can give you some insight as to what number of programs. And then I would just also add, because I don't want to take up too much time answering this question, I want our other panelists to join in. I think one of the things what we saw was that there was an overabundance of applications for programs because people were worried about the process. That being said, it is completely doable, and you don't need to add an additional 15, 20 programs to the application process in order to be successful in the match. I think you still need to be strategic about where you apply in order to put yourself in a position to succeed and not overwhelm yourself and the system with a bunch of applications and opportunities for interviewing.
Excellent. Anyone want to tag in on that question?
Jump in. So something that I've noticed this past application season has been an emphasis on the personal statement, just telling us a little bit about you, because we don't get to meet you in person this time around. And usually when you meet someone in person, you kind of get a vibe about who they are and what they stand for. So really use your personal statement to display who you are and what your personality is. Something else I think is important is something that Dr. Landry said: learn about the program. So no longer can you rely on a visit or a virtual, or a virtual visit is okay, but it's not the same as visiting in person. I do recommend that you follow or look at the accounts of some of these programs on social media. A lot of them have Instagrams or Twitters, so you can kind of see what the residents are up to, what the attendings are up to, and see if your interests align. So that's what I had to add.
Okay, go ahead, Dr. Brown.
I would also say that away rotations are now extra important, just because, it's a great opportunity to get to showcase yourself and to have a program really get to know you. And especially if they're limited in terms of numbers, it's really important to pick the away that you're doing very strategically. So, if you're interested in a California program, really try and emphasize that whenever you're applying to your aways. If you're interested in a very academic program, try and consider that when you're applying as well.
Yeah, I have something to add to that. Like what was exciting, about the past year and also, this upcoming year is that we've been able to reach out to applicants, and applicants were able to reach out to us who otherwise may not have been serious about investigating our program. We were able to, recruit a great class of individuals, and distance wasn't really an issue. The difficulty with that, obviously, is that if they haven't visited the city, it's kind of difficult to understand if this is the type of place where, you'd want to live. But that's why it is important, like Dr. Hamid said, about, getting to know the programs a little bit more in depth and, reaching out to, potentially some of their current residents, some of their educational leadership. I really feel that following them on social media is important to see the types of events they do, some of the things that they highlight, what are, important things to them on their website, what their mission and vision are. So, there are ways to get around not being able to be there in person, but, I think that's basically how I would approach it in terms of getting to know programs on a more personal level.
Right. I think we got you cut off on the last part, but it sounded like getting to know programs on a more personal basis.
Yeah, my apologies. I have basically a bad connection currently.
It's all right. We got you for the majority of that. the next question that I have, and then we'll tail into some of the questions that are coming through in the Q&A. I think that it's unique for emergency medicine to, for the first time, recognize that they called schools that did not have intrinsic emergency medicine programs orphan schools. But although I didn't like the terminology, the understanding that these schools have, disproportionate or are somehow at a disadvantage because they don't have those programs, that they may need a little bit more assistance in trying to get those rotations. What are you guys seeing when it comes to these types of programs or schools that traditionally don't have embedded emergency medicine rotations?
I think before this past year, it wasn't something that was brought up often or mentioned often, but it was something that we knew about because, of our backgrounds, or some of our backgrounds, we're aware of that. We're aware of that disadvantage, but I don't think everybody else in the world of emergency medicine was particularly aware. I think last year it certainly highlighted that fact, and we are taking that into consideration when considering, performance on your slows, performance when you come to rotate away with us. And then also, whenever you apply, we just take into consideration that you don't have a home EM program. You don't have that added benefit of having a mentor at your home institution, being able to go down and drop into the ED and do some observation shifts, learn about these clinical decision-making tools, things like that give the other applicants kind of a upper edge. So we're taking that into consideration, I think, a lot more than we were previously.
I love it.
One of the things that I would just add to that is and Dr. Cortland Brown mentioned this when about the value of the away rotations. I think it's really been an interesting time looking at individuals who've had access to those opportunities versus the have-nots. Because the students who are participating in these away rotations, especially if you're coming from programs or medical schools without EM rotations, this really is your chance to shine, especially from a regional perspective, if you're interested in pursuing residency in that program. But I also think that you have to understand that there is an understanding that your medical education has been interrupted, because we on the receiving end as residencies recognize that when students are applying this application season, they had a very disrupted third and fourth year of their medical school. And so I think school program directors, good program directors, let me rephrase this, good program directors are recognizing the caveats, the limitations to applicants. And I think it's really beholden on you as a medical student to make sure that even now, as you're about to go into this process, that you work with your letter writers. And I know this is sort of jumping different topics, but you as working with your letter writers are working to help craft a narrative to talk about why you're passionate about emergency medicine, both in your personal statement and those letter recommendations, and then to overcome any sort of deficiencies that you may have had or interruptions that you may have had in your application, especially when it comes to limited access to away rotations or a shortened EM clerkship during your third or fourth year of medical school, because that helps us as we review your applications to say, even though this person didn't have the most robust experience or they didn't do 2 away rotations, because nobody can do 2 away rotations, that you still have a component of your application that speaks to your passion and interest in our specialty. So make sure that you're crafting that full narrative as you're going through this. And that a lot of it, this takes strategic efforts, folks. This isn't a passive effort. You got to be strategic as you're going about this.
I just want to highlight something that is in the box from Dr. Brown. She mentioned that there are programs that have essentially emphasized URN participation, and they offer stipends. So it may be a great opportunity to seek those programs because they're going to come with some mentorship experience. They're going to come with, again, some funding to help you and sustain you. So these are important, I would say, things to know going into this cycle. There are a couple of, I would say, longstanding issues that people tend to face, or hurdles that people tend to face. One being step one, the second being obtaining a strong letter of recommendation. So I wanted to first start off by asking, let's start with Dr. Brown. When it comes to having a step one score, and particularly for those who may not have had a stellar step one score going into these applications, how do they build themselves up to shine, or to rather appear like they are strong candidates as well?
Yeah, I think that's a great question. I'm actually really glad that you ask me that specifically because I'm terrible at standardized tests. So I was 2 points above failing step 1, 3 points above failing step 2, barely past step 3, and clearly have made it here. And I'm hopefully soon to be a board certified EM doctor. But I think that it really comes to being very deliberate in your strengths and weaknesses. And so whenever I was going through with my application, I specifically sat down and wrote out my activities. And then I tried to think of a theme that unified them. So for me, it was leadership. So leadership is probably, my biggest strength that I identified at that time. And so then I targeted my whole application towards leadership. So there was a very clear theme. I was basically, forcing people to see that and kind of taking away a little bit from my step scores and some of my other general school scores that were not as strong as a lot of my other peers. So it's important to kind of think about what your strength is and then really, really deliberately gear your application towards that, rather than listing, I have these 10 strengths, because that's just not going to kind of come across as strongly.
Understand, and I agree. I've also struggled, and I think that that is an important thing to note, like that you have to find common threads. You have to think about bodies of work and be a little bit more proactive in how you're going to sell that picture. Dr. Ordonez, you want to add some?
Yeah, I always actually like discussing this topic in regards to step 1. And, to be fully transparent, I also did terrible on my step 1 score. And, I feel like I'm doing well right now, and a successful career in emergency medicine. So I want everybody to, understand that these scores don't define you. They're an objective measure, but, in total, how fair they really are in measuring aptitude is questionable. So I think, similarly to what Dr. Cortland Brown said, is highlight other areas of your application, and not focus too much on that area of weakness. The idea when we look at applications is that it's going to be a holistic review, so it's really important for us to see what other areas of strength these applicants have. And to me, I think a personal statement is important. Admittedly, I'm biased when I hear an applicant's story, about how much they're interested in, eliminating health disparities and work in the social justice arena. So, some EM folks may also have similar ideals. And the other thing is that, similarly to what Dr. Brown said, is if you have other areas, highlight them. Leadership is definitely important. I definitely highlighted that. Also, things like your service activities, if you have a dual degree or a secondary degree, everyone, ideally will look at your application in a holistic way. And, it's a great thing that we're kind of moving away from using step 1 scores. Step 2, I feel, has a little bit more value, but again, standardized tests still aren't perfect. So, at some point that may be something that goes away also, but that'll be, something to see in the future.
Mira, how is your institution, specifically your department, handling their letters of recommendation right now? Like what is the active plan for that in terms of this cycle?
So, great question. So I have a couple of mentees and they're always asking about letters of recommendation. And one of the most common questions that I've gotten is about what letters of recommendation emergency medicine is looking for. And what we're doing is we're looking at the SLO. We're looking to make sure that you're working with an emergency medicine physician that's, similar to us, that is vouching for you and your ability to perform well in the department, and your ability to learn and to take constructive criticism, and your ability to move quickly, help turn over a room, be helpful to the team, different things that we look for in emergency medicine residents and, that will matriculate and become emergency medicine attendings. I would say if you can't get a particular, SLO, some people have asked me, if I can't get another SLO, what are some other things I can do to make my application look good? And I would say when you get letters of recommendation from other off-service providers or other, physicians from other services, it's great to attest to your personality and your work ethic, but it doesn't really say that you'll perform well as an emergency physician. So some things I've told some of my mentees is look for other opportunities to rotate and work with other emergency physicians in other subspecialties like ultrasound or toxicology or any other thing within the emergency medicine box, because those are EM physicians that can attest to your ability to perform well in our department. So I would say that that's my answer so far.
Alden, you want to take that too?
Yeah, that I would just do a hard cosign to what she said about the non-EM clinical rotations, especially ultrasound, sports medicine, toxicology, even peds EM. We often overlook our colleagues in pediatric emergency medicine because that can give you a great opportunity to perform in front of EM physicians for them to offer you candid advice about you as your chances as an applicant, and then also for them to offer letters of recommendation for you. But I would also not discount the fact that we understand, again, going back to the fact that there are those places where you don't have opportunities to do EM, and therefore you may not be exposed to EM physicians and those other subspecialties within emergency medicine. And so a strong letter of recommendation coming from an internist, understanding that you are applying to emergency medicine, or a strong letter of recommendation from a surgeon, especially if you do a critical care or a trauma surgery month, that actually is something that we're going to look at with some scrutiny, because those letters will also offer some value as we're assessing whether or not you're going to be a good candidate for our residency program. So not every letter in emergency medicine needs to come from an emergency medicine physician. Ideally, we would love to see a standard letter of evaluation. I think that is sort of what we have been using as a great way for us to normalize applicants and really compare sort of apples to apples. But then as you look at what other letters of recommendation that are out there, if it's not from an EM doc and it's not from a clinical rotation, do you have a strong letter of recommendation from another specialty like internal medicine, surgery, or even OBGYN that can help us to get a better understanding of you as an applicant and how you would perform in emergency department settings?
Great. I'm starting to go into some of the questions that the audience members are asking, and I want to begin with this first question. It says, what questions would be helpful to ask to gauge the rigor of the clinical training, and if there are any differences between programs? So I'm assuming this means like, how can you frame your questions in an interview, or whether you're talking to someone on a rotation, such that you get better ideas around the differences in training between two different types of programs or multiple programs?
I can take a stab at that. So I think that we'll all probably have different answers. But my personal view is, if it's, a certified emergency medicine program, you're going to get the knowledge. Emergency medicine really is not that hard. It's not that hard to do a thoracotomy. I've only seen a few of them and I can probably do it. So nothing that is super hard, and all of the programs in general will give you, the necessary knowledge. So I think the most important thing in selecting a program is seeing where you feel like you'll be most supported in terms of what your passions are. So, can you pursue your passions outside of emergency medicine? Will you be supported in doing that? Or is it a program that's, 100% all work and no play? If it is, and that's your personality, that's fine. Will your academic interests or community interests be supported? Will you bond well with your co-residents, and can you have their backs, and will they have your backs? Emergency medicine, we have our clinical competencies. So every single program is basically held to a minimum standard. But I think, when I was interviewing for residencies, I would ask them, is there a resident that's doing work on decreasing health disparities in the surrounding community? And the PD should be able, because that was one of my interests, and the PD should be able to answer that question, and then potentially even put you in contact with that resident, and then that resident can potentially advocate for you. So it's kind of about, asking, is there faculty that's doing work that I'm interested in? And that kind of gets you an additional advocate, but also puts out what your interests are and shows how you can then bend with the program. So I think it's less about the actual rigors of the program. There are some that do more ICU months, that do less ICU months. There's 3 versus 4 years. I think it's more so just where is the best fit for you personally.
I like that. Dr. Ordonez, I got a question for you.
Yeah.
In the audience, and also in the questions that I have selected as well, the common theme is, what is like red flags? Like when you're sitting there listening to an applicant in the live interview, or if you're doing a shift and you have somebody that's essentially working with you, what are some of those red flag things that you see that make you say, all right, this candidate is not the strongest, or maybe someone who needs a little bit more time, versus the things that you see that really stand out and are salient of your candidates who you feel are strong?
Yeah, I think the biggest thing in applicants during that applies specifically to emergency medicine, a lot of it is those skills that are kind of about interpersonal skills that you know it's not necessarily easy to teach, or it's not necessarily things about clinical knowledge and whatnot, because I think everybody can, you know, pick up a book or do some test questions and learn what you need to in order to get you know adept at, you know, emergency medicine as a practice. But I think that the biggest thing is, you know, do you work well with teams? How respectful are you with your colleagues and your multidisciplinary staff? I think, you know, it can't go understated how important emergency medicine is in terms of working in teams. So respecting your nursing colleagues as equals, your ancillary staff, and everybody that's basically in the emergency department. So personally, to me, you know, this is kind of like a personal thing. The biggest red flags would be folks that may potentially have difficult interactions, you know, with our coworkers or with our staff members that, you know, that potentially could raise some future issues. Now, you know, I agree that not everybody has a similar personality. Some of our students may be more introverted, and you know, you also have to consider that, you know, not everybody is going to be like, you know, happy-go-lucky and be able to have, you know, have a interesting conversation and whatnot. So some students potentially may get favoritism or something like that during their rotation. So you have to make sure that you're aware of that kind of bias that other individuals may have. But you know, putting everything into context, I think, you know, one of the biggest takeaways from being in a rotation is just, you know, be a team player, showing up early, staying late if you have to, and offering to always, you know, help out when things are needed. So
I just want to echo something that you said. So I've always felt like fund of knowledge was something you could improve upon, but effort and really being able to dig in and sit there and try to like figure out a problem is something that you can't really teach. So I pay attention to people who, you know, you can come in with all the information about a procedure, all the information about, you know, the differential that you have. But if you move with a certain amount of laziness on the shift, if you are always asking to go on a break rather than, you know, thinking about the way that you have to manage your time and manage the work that you're doing to be complete and thorough, those are things that I found as red flags on my rotations. And then when I interview candidates, I'm looking at things like, are your answers really tracking with the work that you've done? Are you giving me canned responses? Like things where I feel like, okay, you just really worked this into, you know, what you wanted to say, and it doesn't really have evidence in terms of what your letters of recommendation say or the body of work that you created. And so that kind of goes with Dr. Brown's point that she made here around like people who don't show a clear passion or an interest. And that kind of becomes very evident when you're having one-on-one conversation.
Can I just jump in here and say that just one key piece of advice when you're doing your interviews is don't be weird. And I know that's like, well, what are you talking about? I'm telling you, we got some people that do some weird stuff during interviews, and you're like, wow, you really don't want to match here because that's just weird, right? And when I say that, I mean, like, I'll give you an example because this is something that truly happened. And I'll tell you why I know this truly happened. It's because we have it framed in our residency lounge. But during the interview, an applicant, while interviewing with the program director, was drawing a sketch of the program director and gave it to him during his interview with him. And then obviously that's weird. And so we did not rank this candidate high on the rank list because we thought that behavior was atypical. So I'm not saying that you need to operate within like the standard margins of like, very rigid margins of professionalism, but don't be on the extremes where people start to question whether or not you're like, a psychopath or something like that. And I know we're joking here, but there is a lot of latitude that we give applicants, and especially in this virtual space. Don't be weird.
That's huge. I interviewed a candidate that pulled out a set of bongo drums. When I asked, like, what does he like to do for fun? He like literally pulled it out from underneath and it wasn't like a cultural thing. It was just like, hey, I do this. And I just thought it was very odd. And I just think that that's important to note. Like, we want to be around individuals who can let their hair down and who are able to express themselves in their identity. But then there's like some odd stuff, and you just say it makes the entire interview awkward at that moment. So
is it okay if I jump in?
Sure, yeah.
I just wanted to share some things that I've witnessed, like in the emergency department, and what I feel like, are red flags for a medical student that's rotating with us. So if you come on shift and you're, unhappy or rude with the staff or patients, that's obviously a red flag, because I feel like if you're doing that and this is a audition rotation, what are you going to do when you become a resident here? If you cannot take criticism or feedback and you don't take that advice to fix whatever you're doing, you now are giving off the impression that you're very difficult to teach or you're unteachable in some way. So that's a red flag. A lot of emergency medicine is about personality, and that 3 a.m. test, like, can I stand to work with you at 3 a.m.? So if you're someone that's continuously coming up to me saying, hey, the CBC back, hey, the BNP is back, hey, the urine's back, and you have no plan and the urine's normal and the CBC, okay, no, go sit down. Someone that has poor social skills, a lot of emergency medicine is about, teamwork and communication. You've got to be able to communicate. So those are red flags if you don't have communication skills. And your knowledge level, of course, is going to be, some students are right here in the middle, and then you've got some students that are, their knowledge level is a little bit higher and some students that are a little bit lower. But if your knowledge level is way below the level of your peers, like I ask you, questions that you should know if you're interested in emergency medicine. What are the ischemic changes that you would look for on EKG? And you don't even know ST elevation. That's something that's a red flag. You have to be reading, and you have to be equipped to perform your emergency medicine rotation. If I ask you to follow up on your patients, you're not following up, or you're moving like molasses. Those are things that are very concerning to me. You cannot help me move this room. In fact, you are impeding my ability to move this room because you're seeing my patient. If you don't have initiative, that's also a red flag. You're not saying, hey, I've been sitting on this patient for 3 hours now, I'd like to see another, or hey, how can I help the team? Is there anything I can do? Maybe going in to see this ultrasound or this cool echo. If you're not showing that initiative, that's a red flag. And then some people are just overly ambitious and sloppy initiative. That's a red flag too. So you don't want to be in there and picking up 4 or 5 patients and you can't keep up, and you're letting labs, you're not ordering the labs, you're not ordering the tests, you're not ordering the medication. So those are things that are all red flags to me.
So to sum it, a couple of things I'm hearing: take initiative, but don't be sloppy. I hear don't be weird, be interesting. I also hear make sure that you have a plan and that you execute on the plan rather than leaving things undone. I like it. I like it. I want to move back to one of the questions that I see here. This is actually a really interesting question, and I'm going to leave it open for anyone that's in the group who'd like to respond. It says, how do you recommend asking for information about family planning during interviews, and how the program handles that during residency? I think this is super important, given that, like, this is becoming a metric essentially for wellness in program, and being able to understand like whether or not you find community in these programs. So does anyone want to, I see Dr. Brown is ready for that.
Yeah, I would say, a lot has changed in the last like 4 years in terms of our perspective. So whenever I was applying, I was told specifically not to ask about that and not to bring it up, which now kind of blows my mind. And now I would say you should be very direct about it. If that's something that's in your next couple of years, or if you're interested in, you want to be at a program that's supportive of that. And if the answer that you're not getting, or that you're getting from the PD, is like, oh, I mean, we try and help, but like, it makes it hard, like, that's not a program you want to be at. Don't waste your time with them. Your life is super important. And, being a doctor, honestly, yes, residency is hard and super time consuming, but it's still hard and time consuming after that. So if, residency seems like the perfect time for you to start a family, then you want to be at a place that's very supportive of it. So I would explicitly ask that. And then you can even ask, at the interview dinners or any sort of like event with the residents, you can ask them if any of them have kids or if any of them have gone through that process, because then they can give you a little bit more of the specifics. So, there are programs that don't have pregnant residents do night shift in their third trimester. In their first trimester, there's some that have different leave policies. There are some that are like more notoriously, don't view it negatively, but aren't as supportive of it. And so the residents will really be able to give you kind of that like background information, but I would say explicitly bring it up during the interviews because you need to know where they stand.
Major point there is that it is basically it is the litmus test, or rather it is an indicator of what that culture at the program is. And I like what you put in here, Amira. Go where you're celebrated, not where you're tolerated. Extremely important. And I'd add one more piece to that. It is, these things will show you whether or not the programs are not just prioritizing these conversations, but also a little bit more progressive and forward thinking. If there is a program that is not having these active conversations, then they may have a work culture that does not align with, longevity, or does not really hope to support its residents. So I actually enjoy getting these questions. I think that it's something I'm hearing a lot more on the front end, and it's helping people prioritize and rank the programs that they do go to.
Yeah. I would also echo that. I think that, by programs being transparent about these types of questions, it shows that they're equity minded, and that they care about wellness. So asking directly about, policies surrounding that, lactation policies, some programs have that. They have areas where, specifically for residents to go to. So like everybody said, it's important to be at a place that's going to be supportive. And if you start getting kind of like a squirrely answer or somebody trying to skirt around it, it's probably somewhere you don't want to be.
I like it. So Dr. Landry, I got a question for you. One of the things that I remember hearing a lot, especially so for those that don't know, I used to talk to Alden pretty frequently when I was a fourth year student. And there was a time where we worried about what skill sets I needed to have kind of going into these rotations and going into the experience. And you get a little bit of anxiety around it, especially if you're like, hey, I've never really been around to put in a central line, or I haven't seen a splint being placed before. What do you think are some of the skill sets that are must-haves versus skill sets that are like, you don't need it right now?
I mean, I think it's obvious that every applicant going into the process should know how to intubate a patient with angioedema. I'm joking, right? Because most ED docs, when we are about to intubate a patient with angioedema, we are like, hey, let's get everybody down here. Let's get the crite kit ready. Who is going to do this? Like we still get a little bit anxious about some of these things. And so I don't think it's realistic for you to come in to think that at the end of your rotation as a fourth year medical student, you should be comfortable with doing really complex procedures. I think it's something to be said about being able to do some basic things like suturing or working on your IV skills or things along those lines. But the reality is the purpose of residency is to teach you these skills, right? Is to help equip you with these skills so that you could be in a position to go out and care for these patients with these regular bread and butter emergency medicine procedures, or with some of the complex procedures that you may not do very often in your career. I mean, it's not uncommon for us as EM docs to be like, you know what, I'm going to go and YouTube that real quick, and just to make sure I'm doing this right. And if you're not doing that, then maybe you're doing yourself and your patient a little bit of a disservice to being a little bit of a little cavalier and saying, look, I know how to do this. I'm up on all of these skills and procedures. So I think it's realistic for you to say, what are some of the basic skills that an EM doc should know? As a medical student, I should know how to suture, how to drop an NG tube, things along those lines. But if you aren't comfortable with doing those things, the time of your rotation is when you're supposed to learn those things. And then obviously during residency, you're supposed to be building those skills along the way as well. So if you come into it and you just haven't had that much experience, it's okay. I think it's really important for you to say, look, I don't feel comfortable doing this procedure, but I would love for you to come into the room and supervise me. Or can you come and check on me in 2 minutes when 5 minutes, 10 minutes while I'm doing the procedure? And that helps us get an understanding as attendings. And also for the senior residents, okay, I need to go check on this individual just to make sure that they are comfortable with this procedure, because that's also not only best for you as a learner, but then also for the patient that we're both caring for.
Nice. Amira, you want to add anything to that? It's okay.
I totally agree. I think that, know the basics, suturing, IND, those are the two most common things that our medical students do in our emergency department. So it's great if what you need, what tools you need. You could look that up very easily using a different online resources. But as far as doing it perfectly and knowing every step, I don't expect that of the medical student. You're going to learn that when you rotate with us.
One of the concerns I had, I remember, was I didn't know how to ultrasound well. I really don't think I'd ever touched the device, and it's partially because at my where I trained, they didn't have one. But one thing that I learned very easily was to explain that, hey, I didn't have that knowledge, but I was hungry to learn how to do it, and that I'd always be open to doing it. Or if anyone needed any assistance during a procedure, like starting at the beginning of the shift, saying, hey, if you have some procedures, you got somebody who wants you need an extra set of hands, let me know, I'll be there. And not dropping the ball at the same time. So that's how I made up on the back end, not knowing all the procedures. And I just wanted to share that with the audience members as well. We got some more questions. Go ahead, Dr. Ordonez.
Can I add really one quick thing is that,
Yeah.
outside of the procedural skills, I think one of the more important things is be able to take a good social history. I think, it's important, especially being the emergency department and us seeing some very vulnerable populations, that it's important that we understand the social and structural barriers that patients, have in accessing care and getting the care they need. So to me, I'm more impressed by a student who will ask, those types of questions regarding housing homelessness or food security, or financial resource strain, that will help us in coming up with a plan for a patient than somebody who doesn't necessarily know how to suture, that we could just teach that information to. So take that into consideration also.
Significant point there, especially because I do think that now more than ever, we're starting to see an emergence of health equity and seeing it kind of like woven into variety, different settings, not just talking about it, but truly seeing how we employ it in our clinical practice. I want to jump back into application stuff for a second, okay? I got a question on here that asked about personal statements that are tailored to the programs. So personal statements that, is it worth having a cache of different personal statements that you can fire off if the program is heavy on research or if the program is heavy on, community engagement? Should you tailor personal statements to the program, or is it just a waste of time?
I don't think so. Basically, what you're saying about changing what your personal statement is about, what drives you, why you want to apply, to the field that you're applying to, what is it that you want to do within this field, and like a little bit about you as a person and why you feel like you'll perform well and what you'll do for the specialty. So if you're, applying to a program that's very research heavy and you're not into research and you've tailored this personal statement for research, you get in, you're going to be unhappy because they're very heavy on research and you could care less about research. So I would just be true to yourself and then try to select programs that align with your values. And you can do that with a mentor within your field. You can sit down with someone. Feel free to email me. I'll sit down with you. I know when I applied to Cook County, that's where I did my residency as well. I sat down as a medical student with the program director and I said, hey, I want to be at Cook County, but if I can't be at Cook County, can you let me know some programs that train like Cook County or that have similar values and mission statements as Cook County? And he sat with me and made like a list of 20 different programs throughout the United States, and I chose where I was going to apply to. But I didn't change any personal statement or what drives me. I just made sure that the programs I applied to aligned with my values.
I like it. Go ahead, Dr. Brown.
I would agree with that. I think if you have a top program, sure, you can make one personal statement that's specifically targeted to that. But that being said, your top program interests should align with your interests. So, if you want to say, I'm particularly interested in X program because they have this, great substance use curriculum and that's aligned with my interests, I think that's fine. But I wouldn't do it kind of beyond that. Also, we do a lot of cross-referencing for the applicants that we're really interested in. So if you're like trying to come off as this big researcher because that's what the program you're applying to is, known for, and we look at your CV and you have like no research, that's another red flag. So, your CV will kind of give that up if you're trying to tailor it too much and go away from what your true interests and passions are.
Alden, you want to add some more?
Yeah, I'm just going to keep it very simple. I wasn't organized enough to keep track of, 10, 15 different personalized personal statements. And so I just tried to keep it simple and keep it honest, with one personal statement that really represented who I was. I think if you're doing that, it can be really complex in how you're trying to tailor an application to a residency program. And I think you're putting way more stress on yourself than you actually need to. One application, one personal statement, one batch of letters of recommendation should suffice you with this application process to going into emergency medicine.
All right. Now is the time where I think that we can ask some I would say more so insightful questions where, well, I want to know if we can deliver some information to the audience members. There is a belief that across all members in emergency medicine, we are one large community and that we talk and that we have, you've mentioned cross-referencing. How often do you think that this changes or weighs your opinion when you hear from a colleague about another person who is a candidate? Does this really impact you or not?
I maybe just to get some clarification, are you talking about if somebody is at another program and they know that we're there and they say, hey, do you know this applicant? Can you give us some insight? Or is
exactly?
Yeah, I think that can definitely help an applicant. And the one time, so what I'd say is this: if you are interested in going to a residency program and you happen to be training, doing a rotation with someone, let's say you're at my institution and you're doing a rotation with me, but you're really interested in going to Stanford where Italo Brown is at. So, and I hear you talking and you're waxing poetically about what your interest there. And you and I have a genuine relationship in so much that you don't feel like you're trying to impress me. You're just trying to impress upon your interest in that particular residency program because of what it has to offer. I'm not going to, stand in your way in trying to build relationships with that program and think about opportunities that are there. And if you, impress me enough, I'm going to take the interest in sending out that email to the likes of Dr. Brown and say, hey, this candidate is coming your way. Be sure to look out for him. And I do this for students who are applying to residency. I do it for residents who are interested in fellowship, and then people who are interested in faculty programs, because this is the type of networking that happens on the back end that a lot of us don't actually hear and know about. I would just say be careful not to do that with every place, and don't say that you're in love with every single program because you or that other individual may get your signals crossed. And so, you got to make sure that you are very strategic in this. And just like you have that number one program that you're keenly interested in, that you may tailor your application to, don't go off sending out signals to every program saying that they're your number one. And as you have these relationships, whether it's with me or with other attendings that you're working with, as you try and help as those sort of informal things happen as part of your application, just make sure that that the signals are clear as far as which programs you're most interested in. And just know that may not mean anything, because as much as I may be sending Dr. Brown an email saying, hey, this candidate is coming your way, he or she is phenomenal, and you really need to look at their application, you still may not be on their radar for whatever reason it may be. And that just may be the situation. And it's not personal. It's not that we're not trying to support you, but each residency program is its own. And that email may be something that is used, or it may be something that falls on deaf ears.
Dr. Brown, you want to speak to that too for a second?
Yeah, I would agree to that. I would also add that a lot of times it can more negatively affect you. So, yes, if somebody does really well during our rotation and they express an interest in another program, if you're speaking to the right person, they will put out that good word for you. But a lot of times it's hard to tell who that right person is, who's going to perceive it the right way. I think we hopefully all would, but I can see, a lot of people in my training and like just people that I know that I would think would respond in the right way, who would actually take it very personally, like now knowing them better. So it's just hard to really judge that person. And if you do really terribly on a rotation, or if you do like a red flag, like if you do like a pelvic exam that's unsupervised, those things do stick with you, and those things will kind of get unofficially passed along. So I would say it's more the sharing of negative information and concerns that I think happens more.
I got you. Dr. Ordonez, there's sometimes questions that arise around students who come from our foreign programs or who come from Caribbean schools. And I wanted to get an impression, at least like what kinds of things can candidates who don't come from traditional U.S. institutions do to show that they are good, strong candidates in emergency medicine?
Sure, that's actually a great question. And I think, there are definitely programs that, are more open to taking foreign medical graduates or non-traditional graduates. And it's important for our applicants to actually look intentionally at those programs, because you are able to get an idea of which of them are, I guess you would call, friendlier to those applicants. But I think that, the same tenets apply, like if you show, in emergency medicine, a dedication to leadership, service, getting involved in organizations, educational initiatives and whatnot. Obviously, there's going to be a little bit more of a magnifying glass on things like potentially step scores, because you're kind of working in a field where there's going to be U.S. applicants, for instance. So is there a potential disadvantage with lower scores? Possibly. Again, especially at our institution, we go through holistic review training, and I'm hoping that most places do, to help eliminate bias in the entire application process. But obviously we have more applicants than there are spots, so you have to take that into consideration. But beef up other areas. We know, I mean, some of the best doctors in the United States practicing medicine are medical graduates. So it's kind of one of those things that has previously been considered like a stigma, but we understand that it's really about the time and the work and the effort that you put in to make yourself a really good doctor. And residency training, once you get that opportunity, again, it's all about the effort, the work that you put in to determine whether you're going to become, a great physician. So, I just encourage them to, continue to highlight other areas specifically that, program directors are going to look at positively, leadership, service activities and whatnot, and make sure, obviously, you get good letters.
Okay. Coming down to my last two questions, you all. Amira, so we've been doing virtual conferences for the last year and some change. Do you think there's any value for a student to participate in these virtual conferences, particularly in terms of trying to make them either better candidates or have higher visibility? Like, is there any value in doing this?
I think I've never had that question before, so thank you for asking. But off the top of my head, I think, yes, there's definitely value. In fact, since conferences have gone virtual, there are some people that probably don't attend because they don't want to sit behind a computer screen. But I would say there are people that probably wouldn't have gone before that are going now because they don't have to pay for the flight and pay for that room and board. So I think, you're liable to put your face out there when you're presenting. We can go back and look if you have an interesting poster and see who's, presenting. I don't have to be there real time. It's recorded online in the cloud. So I think it's a wonderful way to put yourself out there and a wonderful way for you to get exposure. And those national conferences are still national conferences or regional conferences or statewide conferences. So there's still of value and something that you can put on your resume, and it's still a way to show that you are academically involved. So I would definitely recommend it if you have the ability to do so.
I love that answer. Go ahead, Ollie.
Yeah, I would just add, as you mentioned this, it's very interesting because I was just on a conference for the Coalition of Academic Leaders for our Society for Academic Emergency Medicine. So lots of letters that I just tossed at you as far as acronyms. But we were just having this conversation for the Cole meeting, and they were talking about getting more med students involved for SAEM and getting them as to be a part of RAMS, which is the resident and medical student section of our professional organization, and how important it is for those individuals to start meeting people within the specialty, even at that early stage as a medical student or a resident. So yes, definitely take advantage of those opportunities because we think they're valuable for our Society for Academic Emergency Medicine, which is where all your department chairs and your program directors are a part of. So you should be thinking that it's important and participate in those virtual conferences and join an organization like RAMS, because that puts you in a position to get to know folks and be in a better position to match in our specialty.
Got it. Thank you. I'm going to, we've got a few minutes left, and I want to leave these last few minutes for each of you, and I'll go down the line basically to give one piece of final advice. Like if you went back and you were in this interview process, like what would you tell yourself? Like what is the best advice, one piece of advice you would give yourself? And since I would say, Alden, you just finished, you're going to go ahead and tee this off, and then we'll go down the line.
Again, you go to me first. I think you're picking on me, Italo. I don't know what's going on. I don't really have one piece of advice. I have a couple of things that I'll try and throw out really quickly and not eat up too much time. During this application process, don't over apply. Be really strategic about where you want to go. I can guarantee there are not 40 residency programs that you want to go to. Keep that list small and reasonable. Talk with your advisors about coming up with a realistic number that's going to put you in a position to get the number of interviews so you can rank to match. And then take advantage of those resident night outs. And even if they're going to be virtual, go to those types of experiences because that's a way for you to get to know the program differently than when you're getting the professional presentation that you're getting during the residency programs. Those two pieces of advice: limit the number of programs that you're applying to because you don't want to go to 40 residency programs. There's probably only 10 or 12 that you actually would want to go to for residency. And when you get offered those interviews, do the resident night outs because there's so much more information that you're going to get from the trainees of the program that you're not going to hear when the program director or the APD is sitting right there maybe overhearing that conversation.
Excellent. Cortland, you want to add?
I would say don't underestimate the power of a non-PD advocate. So, that residency coordinator that emailed you to schedule your interview, if you're a jerk to them, they are going to tell their PD, and that is going to be a huge red flag. If you were extra nice to them, so, sending an email after thanking them, they probably won't read it, but some of them do, and then they will relay that on to the PD sometimes. Similarly with the residents, if you have a resident that you share an interest with, see if you can take that connection a little bit further and kind of display your work and how you could fit into the program, because oftentimes the residents do have a ton of say in terms of who gets interviewed, how the ranking works. If you're walking around the department on a tour and you see, a patient fall or something happen where you can help out, just kind of get those non-program director advocates on your side and just kind of take advantage of literally every single opportunity for interaction that you have with everybody in the department, not just the program directors or APDs.
Excellent. Dr. Ordonez.
Yeah, my piece of advice is pretty quick. To me, I think it's really important during your entire process when you visit these programs is to just be, authentic. You definitely want to be at a place where you're going to be valued, respected, and you'll kind of be able to figure out early on, how you align with the program's kind of mission and vision. So I think some of the other panelists have mentioned, talking to the residents, will give you a good feel and ask them questions. They're generally going to be very receptive. They obviously want to recruit a good class to their residency program and continue the legacies and whatnot. So, I wouldn't say pester them, but, ask them for some time on the side, if they could talk to you. And I think with things being the way they are now virtually, it provides you an opportunity to engage with people you probably didn't in the past.
All right. And Amira, please close us out.
Okay, so I have three pieces of advice. So when you're rotating, come with it on your rotation, okay? Prepare and perform. It gives us more information about you than step one. And then personality and work ethic goes a long way. So be courteous, take feedback well, and be yourself. And then go where you're celebrated, not tolerated. Apply to the right fit. When I did my in-person interviews, when I was interviewing around, I was making a list of, this program has this, that, but once you see one program, you've seen one program. all the programs are so different. That system didn't really work for me. So what I did towards the end was started after my interview, I wrote down like what the vibes were for the program. Like, how did it make me feel? You know, what were the vibes? And that's how I made my rank list. So go where the vibes fit with your vibes. That way you're going to make sure that you're going to be successful over the next 3 to 4 years.
Fantastic. We're dropping our social media handles in the chat for participants to be able to follow along with us through social media. If you have questions, you can go ahead and address them here. And hopefully we will serve as not just resources, but rather advocates along this process and understand that it is not easy. It's something that sometimes you need a little bit of navigation. And that's why this group has assembled. That's why Toy for Diversity has done these conversations so that you don't feel alone. And I'm going to go ahead and throw it back to Dr. Lovinani, who served as an excellent logistics manager as well as communicator around this. So with that said, Love, you want to give us the final words?
Thank you, Dr. Brown. Thank you to everyone for attending. Please continue to follow all of the organizations that helped make this possible. Tour for Diversity in Medicine, we are on all social platforms at Tour for Diversity. You can follow SNMA at SNMA_official, I believe, on IG and on Twitter, and also follow at LMSA. Please also make sure to let your colleagues know this is being recorded. We know everyone who was applying to emergency medicine couldn't make it, so we will make sure we share it. The point of this was to make sure to get the information out there. Also, please, it was said once in the chat, I'll say it again, powerhouse panel here. Some of you guys are going to be applying to places, and these names that you see on the side are going to be there interviewing you. I suggest hit them up early. Thank you for attending, and hope you all have a good night.
Y'all take care. Good night, everyone.
All right. Take care, everybody.
Night.